Hello, everyone. My name is Temitope Akintunde, and I'm a Deputy Director at Nutrition International. Over the past year, I've embarked on a transformative leadership experience, and I am thrilled to share my experience with you. Throughout my career, I have led the design and implementation of initiatives across various intervention areas, including maternal and child health, nutrition, immunization, and public health supply chains. This past year has been an incredible journey of self-discovery, growth, and impact for me. At the center of this journey is my leadership project, Integrating Gender into Nutrition Governance Projects, a practical guide. This initiative addresses a critical gap in how gender is integrated into nutrition governance projects, an area where know-how and practice barriers often hinder meaningful progress. While gender integration is often considered in downstream interventions like community or health facility-based programs, there is a distinct lack of resources and toolkits tailored specifically for governance projects. Yet, governance establishes the policies and systems that underpin successful programming. My goal with this project is to bridge that gap by equipping teams with a practical guide, complete with actionable tools and steps to systematically integrate gender into nutrition governance projects. Ultimately, the aim is to create transformative and sustainable improvements in nutrition outcomes. Why does this matter? So nutrition and gender are deeply interconnected. Societal norms and gender roles significantly influence nutrition outcomes, often leaving women and girls disproportionately vulnerable to malnutrition and food insecurity. Gender inequality, therefore, is both a cause and a consequence of malnutrition. By addressing these inequalities, we not only improve nutrition outcomes, but also advance gender equality on a broader scale. Nutrition governance refers to the processes and systems through which policies, strategies, financing mechanisms, data systems, and coordination frameworks are developed and implemented to address poor nutrition outcomes. However, many governments and stakeholders face challenges in effectively integrating gender considerations into these systems. These challenges include insufficient sex disaggregated data, limited capacity for gender analysis, and inadequate resources for formulating gender-responsive policies and budgets. At Nutrition International, our technical assistance focuses on strengthening these governance frameworks, and oftentimes this involves working with governments, multilateral agencies, and regional institutions to develop nutrition plans, offer expert advice, and build capacity through long-term institutional support. Given the critical role governance plays, it is essential to integrate gender considerations into every stage of these efforts to ensure equitable and sustainable nutrition outcomes. And so this is where my project comes in. The guide will offer practical guidance to project teams to ensure that there is no missed opportunities to make our governance interventions across the organizations gender responsive. Over the past few months, I have been working on developing this guide and taking a multi-step or multi-phase approach, starting off first with stakeholder engagement, which has involved securing the buy-in and ensuring that there's alignment with the organization's priorities as well as gender equality strategy. And the second step was the desk review, where I spent some time analyzing the literature to understand what are the best practices, frameworks from nutrition and related sectors in development, like WASH, education and agriculture. Stage 3, the key informant interviews, where I was able to engage various experts in gender and governance, as well as project team members, in order to identify the challenges, opportunities, and practical entry points for integration. In stage 4, it was about developing the guide and creating a user-friendly and actionable document. Stage 5 involves the validation and testing of the draft guide document and would include training of the project teams on how to use or apply the guide, as well as testing the content across a select number of projects, and feedback from these tests will be used to refine the content. And the final stage will be the finalization and rollout of the guide. Currently, we're in the guide development stage where I'm consolidating the findings alongside the team. And next steps will include the finalization of the guide, as well as the validation and testing, and ultimately the rollout. Eventually, we hope that when the guide is final, we are able to then train teams to apply it consistently as a standard practice across all of our governance projects within the organization. I am deeply grateful to my family, mentors, coaches, team members, colleagues, various stakeholders who have contributed in one way or another to the project and continue to contribute to it as we wrap up. I am also grateful to the cohort members, an incredible group of women leaders in global health, as well as the entirety of the WomenLift Health team. I'm grateful for their unwavering support throughout this journey. Thank you so much for your time and attention.